وطبعا الوقت ضيق، فان شاء الله تكون محاضره سريعه. انا اسمي عمر داوود، استاذ مساعد جراحه قلب وصدر في القصر العيني. احنا عندنا الحاله اللي هنتكلم عليها is a 38-year-old female. She presented to the internal medicine department with shortness of breath for 2 months, and she had some vague abdominal symptoms: anorexia, nausea, some abdominal discomfort, no vomiting or altered bowel habits. What was significant in her past history was she did a myomectomy, of course in the uterus, 2 years before the admission, and then the leiomyomas in the uterus recurred, and she had a hysterectomy 6 months before this hospital admission. On examination, there was nothing of significance except, of course, the scars of the previous surgeries. زملائنا في البطنه قرروا ان هو يبداوا ينفستيجيت، دوروا على ايه سبب المشكله. They did an abdominal ultrasound and what they found was a bit surprising in the IVC. If you can see here, there is this mass and it's extending above the diaphragm from the infrahepatic IVC and continuing through the IVC into the right atrium from this view. They did a CT scan as well, and it showed a large mass which was also in the IVC and extending in the heart. I think we can see here this area inside the heart showing a heterogeneous mass inside the right side of the heart. An echocardiogram was done to further delineate the pathology. Similar findings. They even saw the mass extending from the right atrium and jumping into the ventricle through the tricuspid valve. Also, CMR was done on MRI, which showed also the similar findings. So the next step was the internal medicine colleagues. They went to the vascular surgery department for consultation. They were not willing to do any intervention at that time. They said there is no role for their intervention, and if the cardiothoracic team would do an intervention, they could join us for an IVC thrombectomy. And they recommended full anticoagulation to the patient because till that point we didn't know, is this a thrombus or a tumor or what's the sure pathology. So they came to the cardiothoracic surgery for consultation. Would you do surgery for this patient? And we said, yes, we do. So we went for surgery. We were thinking about our surgical strategy. يعني الفكرة لو أي جراح بيفكر أنا دلوقتي الاي في سي ده completely occupied by a mass، مش هقدر أحط فيه كانيولا، مش ضامن تحت حتى لو حطيت فيمورال كانيولا هتوصل لحد فين، ممكن تديسلوج الماس. ف التفكير بتاعنا كان ان احنا هنعمل arterial cannulation through the aorta، ده ما كانش فيه مشكله. The other issue was the venous cannulation. We went for a single venous cannula selectively in the superior vena cava with a tape around it for the bypass, and for the rest of the flow coming from the IVC would be with the suckers inside the right atrium. And we adopted an intermittent low flow bypass so that when we were dealing with trying to extract the mass from the IVC, we went down with the flow so we could be able to see the mass and try to extract it. ده كده شكل الانتراوبراتيف تي اي. هو زي ما حضرتك شايفين في الماس دي بتنط جوه الفنتريكل اثناء مع الكاردياك كونتراكشنز، وفي باين فيها زي كده فاكيوليشن كده موجود هنا الحته دي، زي ديجنريشن في الجزء ده من الماس اللي هو فوق جوه الرايت اتريوم. بدأنا بقى الجراحه. شايف الصوت ده ممكن يوطى عن كده. زي ما احنا شايفين هو كان التحدي الكبير ان احنا نعرف نسلك الاي في سي ماس دي من غير ما نعوره، لان هي الماس extending in the abdomen quite deep inside up to the infrahepatic portion of the IVC. فتحنا الرايت اتريوم وحاولنا كان الجزء طبعا اللي inside the atrium with the ventricle ده was mobile وما كانش فيه مشكله. الجزء كان inside the IVC هو اللي كان occupying almost the whole circumference of the vessel. So with manual manipulation we tried to separate it from the wall and pull it out in one piece. ده كده واحنا ماسكينها، وده المنظر بعد ما خرجناها. طبعا الجزء اللي كان فاكيليتد اللي فوق ده كان فيه شويه فلويد وخرج، لكن ده الشكل النهائي بعد ما طلعنا التيومر او الماس ده. Post operatively the course was smooth, no issues. With a follow-up after the surgery, whether using an echo or the abdominal ultrasound, as we can see, the IVC and the hepatic veins and all the abdominal portion of the IVC, as well as above that level inside the heart, it was free. No residual mass was found, whether from an abdominal approach or from an echocardiographic approach. The pathology came out as a leiomyoma, so confirming the diagnosis of an intravascular leiomyoma extending into the heart in the right side of the heart. Thank you very much.